more, Jennifer Keller is going to talk to us about, I think, an exercise study.
Okay, so this is like the speed dating version that exercise is good for you. And oh, I don't, okay. And just to give a little plug, like an advertisement, so you don't have to think very hard. We've told you a lot about that there's a link between pathology and like impairments like weakness and sensation and activity like balance and walking. So we always say that I always say that you should strength training your hips and that you should do some balance training. But our current standard of practice is people come in for an annual exam to our clinic. We measure all these things. We say you should go exercise, and then we remeasure a year later. And so there's this problem that there's this big black box that you don't really know what happens in that year. And that's not necessarily bad. If you know something about exercise, you're probably getting some good exercise. And if you go to a local PT, it's kind of a mixed bag of what you might be getting. So we don't really know, but we don't know what works best. So the other problem is that measuring a whole year later, a lot of other things can have happened in that time. So we don't know what's the most beneficial thing. And so it leaves us with a lot of questions. Like I already said, what one would be best? Maybe doing one thing in particular first and then something else second would make sense. And what's the dosage for it that would be ideal, or for how long we might need to do exercise. And then in addition to that, excuse me, sorry, exercise might have an effect, hopefully it does, on these measures of sway and gait that we talk about. And we know that that's meaningful. And so if they are, it's important that we optimize these rehab interventions that we recommend, because they can be helpful right now. And then they may also be really important to know about in terms of using these outcomes for future clinical trials, because as endpoints, we would want to make sure that everyone is exercising at the same level or intensity as well. So our first step is a pilot study to provide an individualized structured exercise program that does these pre and post quantitative assessments that Amina and Bella and Hemo talked about yesterday, and then also to offer it remotely so that we can standardize the intervention and give adequate supervision and then reach the most people. And we're going to do this using, in particular, two studies that I've done before, but optimize them so we know that a home balance exercise program had improved balance and walking for a group of people. But one of the main limitations was that people weren't always able to challenge their balance effectively. So I think giving more supervision will be beneficial to improve that. And then we've done a strength training program for people with MS, but they came in person 3 times a week. And that's a big burden and difficult to implement, across the country. So modifying that so that it's possible to do it in your home with supervision is what will happen with that aspect. So the paradigm is 2 pre-test visits so that you can be a control for yourself and we know how much you change. And then either doing the balance intervention or a strength training intervention, or a coaching model where we would help educate based on what's most important to you. And then finally, a post-test visit. So overall, the people that are eligible now would be adults, both men and women, who are able to stand and walk. It's a 12-week commitment. It's a pretty big commitment for your time. There's going to be 18 hours of training. So that's just something to keep in mind. And it's a rolling admission. So we don't take everyone at once, but we would be fine if you wanted to bang down the door. And the people you want to contact are Jordan and Vita, who I think are sitting back over there, but and they can help give you some more information about the trial. So we have a little bit of funding from Cure LBSL. We're doing it with people with LBSL as well, and adults with ataxia. So that's why it's got a broader title. But thank you for letting me tell you about it, and I'll take any questions.
Any questions for Jennifer? No, you didn't put on the prerequisites that you had to have the ALD, and I was just thinking, no matter what, this would be useful. So do you have to have a diagnosis, or can you just be whatever it was, 18 to 65?
75. We do have a control arm also. Is that what you mean? Like you don't have to have
I guess I didn't realize it was a control versus patient, because at one level, I mean, as we age, we lose balance and all that. So all of this would be good regardless, I would think, but you're the
Sure.
expert.
I mean, I think it's always important for us all to exercise, and we do need to know, how much stronger people can get in general. So yeah, it's hopefully something everyone would like.
Question. Kelly, do you have someone that?
Yes. Oh, thank you very much for everything that you've done regarding exercise. And I was curious, for folks that are already participating in strength training, is there a way that we could participate in this? I know it would be hard to measure a change since we're already exercising. So I was curious if there was some kind of a way that we could be involved.
It's a very good point. There always are questions about exercise studies about how much, do we recruit people that are already like to exercise a lot and already have a certain amount of fitness, or if we have people that are, different levels at which they start. I think you would find most people don't do the strength training program in the same way that I'm implementing it, where we're focused on a single isolated muscle group. Typically people go to the gym and use equipment that kind of allows you to use multiple muscle groups. So I would assume that we would be additive to what you're already doing in order to focus on those key muscles that we're addressing in this.
All right, thank you, Jennifer.